everyone. Good morning, good afternoon, and good evening, depending on where you're watching us from. So my name is Mabbie, your favorite nurse, and I welcome you all to my YouTube channel, Mabbie Health. Please, if you are new to this channel, kindly subscribe, hit the notification button, share, and like my videos. And to my old subscribers, thank you all so much. Thank you for supporting your girl. Your girl is really thankful, and God bless you. So today, I'm excited about our topic that we are about to discuss today. So we want to discuss asthma. Yes, you heard me right. We want to talk about asthma. Slowly, we are approaching the raining season. The colds, the dryness of the weather and everything is going to trigger a lot of asthma. So we want to brace ourselves for it. We want to learn about asthma, how to prevent things that will trigger your asthma if you have it, how to protect or guard yourself from asthmatic crisis. Okay, so that's what we want to talk about today. So one will ask, what at all is asthma? I've been hearing about asthma. When you hear about asthma, all that comes into mind is inhalers and breathing difficulties. Yes, but today we'll delve much into it, and if you want to learn more about asthma, please stay with us to the end of the video. Please don't forget to subscribe if you are new to this channel. Please hit the notification button, like my videos, and please share. Thank you. So one may ask, what is asthma? So asthma is a condition in which your airways narrow, swell, and produce mucus. When we say mucus, it's phlegm. Okay, so when your airways becomes narrowed, swell, and begins to produce mucus, it becomes difficult for you to breathe. It makes breathing difficult, and it triggers coughing, sneezing, and shortness of breath. So you realize that you begin to breathe in pieces. Your chest becomes very tightened. You have difficulties breathing because of that. You begin to cough, and then you wheeze as well. You begin to wheeze. Wheezing is basically a sound you make when you exhale. Yes, so there's this see how bees buzz. Yes, the buzzing sound of bees. Yeah, you begin to hear that kind of sound in your breath, especially when you breathe out, you exhale. Yes, so we say that for some people, asthma is just a minor thing that happens to them, and for others it's very life-threatening, and it interferes with their day-to-day activities. So we talk about symptoms, signs and symptoms of asthma. The truth is that asthma cannot be cured, but it can be controlled. Asthma cannot be cured, but it can be controlled. I've been hearing some rumors that herbal preparations can cure asthma. I don't know about it. What I know from science is that asthma cannot be cured as it stands now. Yes, we are evolving, so it's likely that some few years to come, some decades to come, we'll have a cure for asthma. But as it stands now, there's no cure for asthma, but then it can be controlled. Yes, so we talk about the signs and symptoms of asthma. The signs and symptoms of asthma ranges from minor to severe depending on each individual. Every person has a different way they respond to asthma. So the signs and symptoms they get pertaining to asthma differs from person to person. So we spoke about shortness of breath in our definition for asthma as one of the signs and symptoms, one typical sign and symptom of asthma. So you have shortness of breath. We have chest tightness and pain. There's this tightness in your chest that makes it very difficult for you to breathe, and it's accompanied by pain too. So you see them gasping for air. Sometimes they tear off their shirts or any clothing that they are wearing. They want to rip it off just to make sure that their chest is less tightened and they can breathe in. Okay, so you have trouble sleeping because of the shortness of breath and the wheezing sound. So sometimes they have trouble sleeping. There's this whistling and wheezing sound in their breath when they exhale. And then another sign and symptom is a coughing or wheezing attack that is worsened by any respiratory viral infection like cold or flu. Yeah, so these are the signs and symptoms of asthma. So there are few things that when you notice, you know that your asthma is getting worse. You know, there are one or two things that if you are asthmatic, when you begin to notice them, it should tell you that your asthma is getting worse and you need help. You need help. If I say you need help, I mean you need medical help. Talk to any healthcare personnel, talk to your doctor, talk to nurses, talk to anybody that's in the health field, and you get immediate assistance. Okay. So the signs that should tell you that your asthma is getting worse is that one, your asthma signs and symptoms becomes frequent and bothersome. So you realize that initially there's wheezing and there's cough, but it doesn't interfere in your day-to-day activities. You get it? But with time, as time goes on, you realize that the coughing has become very persistent. The wheezing has become very persistent, and for days it's not resolving. It begins to interfere with your day-to-day activities. You are not able to even make a complete sentence without coughing out or sneezing, you know. Yes. And the second thing is that breathing difficulties increases as well. You also realize that before you have a little shortness of breath, let's say between 2 to 3 minutes, between 2 to 3 minutes, it will be resolved. But as time goes on, you realize that even after 10 to 15 minutes, 30 minutes beyond, it's not resolving, and it's very bothersome. So you will notice these kind of things. It should tell you that your asthma is getting worse and you need to see a doctor. Yes. And you also realize that the need for you to use your inhalers becomes very frequent. You realize that for some time you need to use your inhalers about 5 to 6 times in a day before you'll be okay. But it wasn't like that before. Sometimes you could go a whole day, a whole week without using inhaler. But you realize that now it has become, the use of your inhalers have become very frequent. You have to use it almost like 6 to 10 times in a day, and it's bothersome. Yes, it should tell you that your asthma is getting worse and you need to see a doctor. So there are situations that makes your asthma symptoms flare up. There are situations that predisposes you to having these symptoms of asthma. So we say one is exercise induced. You realize that after exercise, during exercising, you realize that your chest becomes to tighten. You begin to go out of breath. You know, you begin to cough so much that it doesn't resolve. You know, and the symptoms that you have anytime your asthma is being triggered begins to show up, it should tell you that your asthma is being flared up. That situation makes your asthma flares up. So you have to take notice of that and stop immediately. Yes. Another thing too is we talk about occupational asthma. Yes, occupational asthma has to do with things that triggers your asthma at work. And these things could be irritants such as chemicals, fumes, and gases. So my people that work at spraying companies, car spraying companies, those that work with chemicals, those that work with gases and all, if you have asthma, definitely it's going to be triggered in a situation like that. So when you are going to work, the best thing is to find another work to do if it's possible. If not to, you have to take very good care of yourself each time you're at work. You make sure that you wear your PPEs. Yes, you wear every garment you're supposed to wear, your face masks, your face shield, your goggles, like anything that will protect you from coming into contact with these gases, these chemicals, and those fumes. You have to protect yourself, because as soon as you get into contact with those things, your asthma is going to flare up. Yeah. We talk about allergies too. If you're allergic to something, usually allergic to drinks or foods that contain chemicals and all that, it will make your asthma flare up. And so take notice of these things and stay away from them. So on this note, I want to say that severe asthma attack is very life-threatening, and so you need to seek emergency treatment anytime these symptoms begin to show up. Yes, don't joke about these things that I'm talking about. It's very life-threatening. In other words, it can kill you. Yes, so please seek emergency treatment each time you notice them. So I want to talk about a few signs of asthma emergencies. Yes, asthma emergencies. When you notice these things, do not sit down. Find your healthcare provider or your doctor. Speak to somebody. So the first thing I want to talk about is rapid worsening of shortness of breath or wheezing. So you realize that within a very short period of time, your shortness of breath becomes aggravated, like it worsens, and you begin to wheeze non-stop. Like the wheezing becomes very severe. The wheezing sounds become very severe in your breath. Yes, that's the number one thing that should tell you that you are in asthma emergency and you need treatment as soon as possible. The second thing too, you realize that there's no improvement even after you use your inhaler. You can use it 5 to 10 times. Realize that it's not working. It's not working. You keep getting out of breath. The inhaler is not helping as it used to. It should tell you that you are in asthma emergency. And when you are doing minimal jobs too, you realize that there's shortness of breath. Assuming you can lift about 50 kg of load with ease. Now you even lift like 10 kg and you are out of breath. Yes, it should tell you that you are in asthma emergency, and so you need to seek immediate treatment. Yes. Okay, so let's talk about causes of asthma. Exposure to various substances that trigger allergies and irritants can trigger the signs and symptoms of asthma. Okay, so let's talk about triggers. Yes, the triggers of asthma. We have airborne allergies. Airborne allergies include pollen, animal dander, cockroaches. Yes, cockroach, kakalika, mite, and so on. Yeah, we talk about respiratory infections, viral respiratory infections like flu, that's influenza, common cold, rhinitis. Yes, all these things are respiratory infections that can trigger your asthma. You have physical activities, that's exercise induced asthma. I spoke about it earlier. Yeah. We also have cold air. Cold air. Those that love being in the AC, yes, it will trigger your asthma. Those that love being in the coaster, yes, it will trigger your asthma. Don't expose yourself to cold. It's one of the triggers. We have air pollutants and irritants like smoke. Yes, you have fumes from cars and from factories. We also have certain medications like aspirin, ibuprofen. For ibuprofen, we talk about Advil, we talk about Brufen. Yeah, it all triggers your asthma. It's a trigger. You have strong emotions and stress. Yes, strong emotions and stress. You realize that there are people that when they are emotional, as in extremely sad or extremely happy, they even choke on their words. They are not able to speak up. There's this tightness of breath, especially when they're extremely sad. And even some of the words they try to speak does not come out. Yeah. So if you are asthmatic, look out for this. I'm not saying you shouldn't be happy. Yeah, I mean, who doesn't get emotional in one way or the other? So we also have sulfurs and preservatives that are being added to certain foods and drinks. Yeah, like shrimp, dried dates, processed potato, beer, and even wine. Yes, so if you're asthmatic and you want to take any of these things, make sure you read the labels, yeah, before you drink. We also have a condition called GERD, gastroesophageal reflux disease, where acid in the stomach is backs up to your throat. Yeah. And we also have menstrual cycle in some women. Yeah, not everybody. Some women. Remember we spoke about stress and emotions. Yeah. So let's talk about the risk factors of asthma. The number one risk factor is family history. Yeah. So if any relative, especially parents or grandparents, have a history of asthma, it is likely that you can also have it. Yeah. We have allergic conditions like rhinitis and hay fever. It can also put you at risk. We also have overweight. Yes, you heard me right, overweight. So please begin to do some exercises if you realize that you're adding on weight. Yeah, so that you will not be at risk of getting asthma if you do not. Yeah. We also have exposure to secondhand smoking and smoking itself. If you smoke, please put a stop to it. If you know you can't put a stop to it abruptly, please reduce it. If you smoke about 3 sticks a day, do one, and eventually you'll be able to stop. That's if you're a smoker. And if you are not, please don't be a passive smoker. Being a passive smoker doesn't necessarily mean that you sit among smokers. No. If somebody smokes and you are within a range of 2 meters, you're a passive smoker. Even when they are standing in their corner somewhere and you go and pass by, you're a passive smoker. It does not have to only do with cigarette or weed or like anything cheap. No. It has to do with smoke. Yes, the smoke that rises in the air. Yes, that's what we are talking about. And so if you are someone that cooks with firewood, you are at risk. Please, we are evolving. You can do charcoal, you can do gas, you can do something else rather than the firewood, because you are putting yourself at risk. Not only asthma, but other health conditions. Yes, other health conditions also. So if you are a passive smoker, a second-hand smoker, please be on the lookout for yourself. Okay, so I would like to talk about a few lifestyle and home remedy. Okay, so you follow your asthma plan. If you visit any healthcare provider or a doctor, he or she is going to take you through some asthma plans that will help reduce signs and symptoms and even prevent them from coming at all. Yeah, so when you have this asthma plan from your doctor or from your healthcare provider, please follow it. Yes, it's going to go a very long way to help you reduce your symptoms drastically. As I mentioned earlier, asthma cannot be cured as it stands now, but then it can be controlled. So please, let's help ourselves to control our asthma. Yeah, you need to identify your triggers and stay away from them. Identify your triggers and avoid them as much as you can. We mentioned the triggers earlier, so if you followed from beginning to now, you should know about the triggers that I'm talking about. And I mentioned earlier that asthma triggers varies from person to person. The things that will trigger my asthma will definitely be different from the things that will trigger your asthma. So identify yours and avoid them. So we also talk about you identifying your triggers and treating them early. It's one thing to identify your trigger and avoid them, and it's another thing to identify and treat them. Yes, identify and treat them to avoid complications. You have to take your medications as prescribed and pay attention to increasing use of your quick relief drugs, that's your inhalers. Pay attention to increasing. If the frequency at which you use it in a day increases, pay attention to them. It means that your asthma is worsening and you need immediate attention, immediate medical care. Pay attention to these things and you will definitely avoid life-threatening situations when it comes to asthma and its management. Okay, so we've come to that point. Yay! I'm excited about free tip, I knew you're excited about it. So we've come to the point where we give out free tips. Yes, so free tip number 1: if you are asthmatic or you know anybody that has asthma, a family member of yours gets asthmatic attacks either frequently or once in a while, please let honey be your friend. Yes, sweet honey, let it be your friend. Keep honey in your cupboard, keep honey in your fridge, like anywhere you can preserve honey, keep honey with you, so that anytime a friend or a relative of yours gets into any asthmatic crisis, you will be available and ready to help. So this is how you use your honey. You pour a little, about 5 ml is enough. Yes, about 5 ml into a clean cloth, preferably handkerchief, because it's light and you can breathe through it very easily. Not any heavy cloth that's breathing through it will become difficult. Yes, get a clean cloth, preferably handkerchief. You pour about 5 ml of the honey into it and then you sniff it. Yes, it's going to open up your airway, and then breathing will become less painful and less difficult. Yes, that is the free tip I'm giving you today. Honey and handkerchief is going to do the magic, but please, that is not a permanent solution. In cases of emergencies where your quick relief drugs are not available, or you run out of your inhalers and all that, the next thing you can resort to is the honey in the handkerchief, where you sniff it about 3-4 times and you realize that your airway is opening up, and then your tightened chest begins to lose up. You begin to breathe more comfortably again. So another free tip, I would like to demonstrate how the inhaler can be used. So when you're in the hospital, you realize that people come around, and though they have their quick relief asthmatic medications with them, they are still out of breath. It's not because probably the increasing the use of it has increased over time. They didn't take notice of that, and now they are in life-threatening situations. Some people do not use it well. Yes, so today I want to demonstrate how it can be used to you. So this is Symbicort. Yes, and the most popular one that everybody knows is the salbutamol inhaler, the one that comes in an L shape like this, the salbutamol inhaler. So let's do the Symbicort first, and then we'll do the salbutamol inhaler. It's on your screen. Yeah, this one. Yes, that's what I'm talking about. Yeah, I don't have it here, so I'll show you how that one too is done, but you can see it on the screen. Yes, that's what I'm talking about. So with the Symbicort, it's like this. I hope you can all see that. Symbicort 160, the one I have here, has 120 doses inside. So you twist it like this to open it. Yeah, this is it. And this red thing here shows the number of doses inside. So it's 120 dose. So each sniff reduces. So you sniff one in, or you inhale one, the number of doses here decreases. So it would let you know if you still have more inside or less in it. So if you have this, keep looking here at this little red thing here. That will show you the number of doses you have left. Yeah, so you twist it. You see, I twist it. You twist, you open, twist, put it in your mouth. Make sure that your lip is completely sealed with it. You saw that, right? You pull it inside, your lip is completely sealed, like I did. You saw that. Then you pull the drug inside. Yes, so that's how Symbicort is used. And the one on your screen, yes, the L-shaped one on your screen, it has the cover at the tip. The drug itself is in the chamber up there. So when you open it up, some people keep it in their bags, and you realize that when they bring it out, there's dust all over. Some have food, debris, and a lot of things around it, especially with this one on your screen. Yes, so it's ideal that when you're using it, you open the cover and push one of, as in you push one into thin air, so that if there's anything covering the tip, it will clear it off. Yes, so don't want to you put it in your mouth like I demonstrated with a Symbicort, and make sure that your mouth completely seals it. There's no space that will make any of the drug escape from your mouth. Yes, so you put it in your mouth as demonstrated earlier, and then that one too, you push down the barrel. The drug has been fixed inside there, so you push it down, and then you make sure that you sniff that one too inside of you. 2 puffs anytime it is necessary for you to do it. That means that you go through what I've demonstrated to you 2 times. Yes, anytime you feel that you are getting these signs and symptoms of asthma that we spoke about earlier. Yes, if you do this, your asthma is going to be under control. And hey, if you see any of the triggers we spoke about, please avoid them, whether it is your trigger or not. Simply avoid them. But it is very good for you to know the things that trigger your asthma, so that you can completely avoid those things in order to keep your asthma under control. All right, so I enjoyed this talk so much, so that I was so much into it. I don't know if you noticed. Yes, so if you did, kindly show me some love. Please hit on your subscription button, the notification bell to like and share. Please support your girl, support your favoriteness, so that I can always appear on your screen and share exciting health tips with you. Okay, so on that note, if you have any questions, please drop it in the comment section, and I'll be here on your screens again answering every question. Please and please and please and please support your girl, support your favoriteness, so that I can always bring you exciting health tips. And please, to my old subscribers, thank you all. Continue to like and share my videos. So I'll see you again same time next week. Bye.